Reproductive justice is when people have the social, political, and economic ability to make decisions about their reproductive health. When you can decide if and when to have kids and to raise kids in a healthy and safe environment, that's when we would have reproductive justice, and that's the work that we do to make it accessible in our communities. My name is Shayla. I am the Executive Director of Our Justice. We are a reproductive justice organization and an abortion fund.
My name is Megumi Ryerson. I'm the Program Director at Our Justice. Just because abortion is legal doesn't mean that economic and racial injustice that impact people's ability to pay for and feel safe at clinics is impacted at all. It does not solve the injustice that queer and trans people face when they go to clinics and they're either misgendered or faced with sort of homophobic content and rhetoric from doctors. And it also doesn't address any sort of injustice that people with disabilities face when trying to access dignified health care. So what reproductive justice and our organization's framework aims to address are the actual gaps between the letter of the law and the reality of accessing it. We help people access abortion care by paying directly for their appointments, helping them navigate their insurance, and also paying for their hotel rooms if they either need to travel from a state where abortion is illegal or if they're from Minnesota and they need a safe place to stay.
We offer free Plan B. We refer people to abortion doula services, to transportation services. So in order to get here, get to a clinic. And then we have a really great program, I think, that I'm really excited about, probably the most excited about, called Emerge, which is a post-abortion support group. It's centered on healthy expression and just being a support system to folks who have had that experience. My name is Shavonda Brown, and I'm the Communications and Advocacy Director at Our Justice. So we provide direct services to folks who need them, and we also advocate at the legislature to make changes there.
And we represent this with this opportunity to go and sue the state of Minnesota to make sure that people can access reproductive health care. So Dovey, Minnesota is a lawsuit that removed a lot of unconstitutional barriers and bad laws that should have never been passed. We went to the state and say, hey, just get these off the books. And we did it.
Community response to the work that we do is really filled with gratitude. I think a lot of folks are really grateful that we're here and that we're fighting and advocating for reproductive justice, and that we also provide these amazing direct services, and that we're a community where folks are able to gain access in ways that they're not able to, within their own means.
And the more that you allow someone to believe that they are entitled to safety and to dignity and to a healthy life, the more that oppressive treatment and structures become intolerable. So it is my hope that slowly but surely people believe that abortion restrictions and any sort of limitations on their bodily autonomy are unacceptable.
I see reproductive justice being everywhere, and it touches every kind of justice movement, whether you're talking about water protectors or the fight for $15 minimum wage or housing. That's all part of reproductive justice, because without those other pieces, we cannot decide if and when to have healthy families. It's all interconnected.